It's Tuesday, January 11th. Today, the province of Ontario confirmed that schools will return to in-person learning on Monday, January 17th. There had been some speculation that elementary grades might continue with virtual learning for another couple of weeks, but apparently that is not the case. Elsewhere in Canada and around the world, there have been many different approaches to getting kids back to school. And tomorrow we expect to hear more details from the Ontario government about how all of that will play out. In the meantime, there's a lot of uncertainty and questions about how this will unfold over the next few weeks. So that's why I've asked not one, but two doctors, Blaine, to join me tonight to shed some light on the back to school debate. Dr. Sean Blaine is a family physician and Dr. Kirsten Blaine is a pediatrician, both practice medicine in Stratford, Ontario. Welcome to you both.
Thank you very much, Craig. Thank you.
Just over a week ago, the Ontario government delayed school by 2 days to January 5th, then bumped it by 2 weeks to buy time to get the schools ready. Would you be sending your kids back to school next week?
Gladly.
Absolutely.
Yeah.
Can you elaborate on that? What do you think about
Sure.
that?
I mean, I think that different kids, different age groups have slightly different discussions or things that we want to talk about with them. We have teenagers right now and they're high school age, and there's no question they're going back. If we had younger ones, we would also be sending them back for sure.
What about the vaccination situation? Less than half of all children between the ages of 5 to 11, I believe that's the number that have just their first dose. And everybody's been talking about vaccinate, vaccinate, vaccinate. So what role does vaccinations play in getting kids in the younger age demographic back to school safely?
Well, in terms of vaccination, when it comes to vaccinating kids, it's probably helping slow the transmission, and because really kids in general don't get that ill with COVID. They can rarely, but in general, we'd like to get the highest level of vaccination possible right across the population, because what we're seeing is that when you are fully vaccinated, you are, it might not prevent you from getting Omicron, but it's certainly going to prevent you from getting very ill with it. You're much more likely to end up with serious problems if you are unvaccinated. So that's why the push is there for really all age groups.
And there's an interesting piece of information that's coming out that might even be reducing the risk of children getting this rare inflammatory condition called MIS-C. So being vaccinated actually protects against that very rare thing that is probably the most serious consideration for us with children.
What about the spacing between the doses for that younger age group? They had said on several weeks, and then they said parents can make the choice about accelerating that. So where do we stand in terms of the pacing of between the first and second dose?
Well, I think that ideally the longer time period for your immunity levels, we have some good evidence that about 8 weeks is better as far as getting the best possible immune response from the vaccine. I think that what's led to the more urgent nature and asking people to do it sooner is the fact that what we want is as much protection as we can as soon as we can. And that we might sacrifice like a 5% protection to get that child vaccinated and protected that much sooner.
How will parents know if their school is prepared, and what does that preparation look like, do you think?
Well, I think the schools have done a great job of adapting to this situation. We've been in this now for 2 years, and but when you're talking Omicron, it's really tough because the transmissibility is just that much greater. I know that they talk about those HEPA filters going in, and I'm sure that helps to a degree. I think it'll probably help to have better quality masks. So I think cloth masks probably, probably not as good as a regular 3-ply medical grade mask. They're talking about distributing N95 masks for the teachers, and certainly we now in healthcare, when we are in direct patient contact, we are, we're getting very close to people, so we're wearing N95 masks and eye cover. But boy, if you're teaching a class, it's hard to stand in front of a classroom with an N95 mask on and you know, how do you do that? I don't know. But you know, the distancing already has been happening in the schools. I honestly think the schools have probably done everything they possibly can. But Omicron's a different animal. That's for sure.
It is for sure. I don't think that we can spend any more energy or time, you know, arguing that we need to take the kids out of school longer to make the schools more prepared, because I don't know that we can. You know, sure, there are more measures that could be taken. I guess I'm not the expert on the air filtration and that sort of thing. But the bottom line is Omicron is so contagious. It's like the measles, or they're comparing it to the measles. I don't know if that's exactly statistically correct, but and you can't stop measles from spreading in an environment, no matter how much you clean the air. So
many parents are I see that point. Many parents are asking also about, you know, what if my child has a runny nose or a cold? They've stopped testing now, and we have rapid tests in some cases, but what do we do if our child is exhibiting symptoms of a cold? How will we know if it's Omicron or just a regular common cold? And what do we do if our child is sick?
I think we both, probably from the family practice point of view and from the pediatrics point of view, do you want to?
Well, I mean, there's a great a flow sheet on the ministry website. You know, how do you know if you have COVID-19? And there's 4 basic symptoms to start with. You know, fever, cough, shortness of breath, and then there's a whole bunch of secondary symptoms, right? And honestly, with Omicron, it can masquerade as anything. So bottom line, if you're sick, you stay home, right? I mean, that's just the way it is. So
let the school know, obviously, and they do whatever they have to do, right? Yeah.
But if everyone is, if our approach to this is, yes, we're going to try our best to have all the kids in school, but the minute a child has symptoms, that's when we're going to get more aggressive about keeping our children home, if possible. Mm-hmm. And we know that for many families, that's a true hardship. We have to. That's the part that where the sacrifices as far as school attendance are going to have to be made.
It's interesting. Many of the pediatric societies and organizations are saying that the mental health toll on children should be equally a concern as the potential of getting Omicron. The mental health toll on families and children. That there was an interview earlier today on the CBC from a pediatrician saying that mental health of children it should be considered as we make a decision about putting their social interaction and things like that with other kids, meaningful contact with their kids to get back to school.
You cut out there for a bit. The connection was a bit rough. So, I mean, the social interactions are absolutely critical. I was talking to a parent today who is struggling with young kids that are trying to do remote learning, and this is a young mother who's in teachers college herself, and is trying to have her group of students that she's teaching, and her kids are hanging on to her. So, you know, it's just it's kind of brutal. So
when do you think we'll know when we're out of the woods? Is this a matter of weeks? Like when the kids go back to school, what will you be looking for?
I think we'll see an increase again. I think we've already, this is just anecdotal. This is just early, like based on our experience in the hospital right now. We're seeing a little bit of a dip in just the regular viruses because people are maybe out of school, but for the last few weeks, or it's truly, some of the viruses are actually settling down. But it'll be impossible to know. You know, there's that lag, you know, there's that, 2, 3, maybe even 4-week lag before we'd see whether that's having an impact. Interestingly enough, part of that letter, the Canadian Pediatric Society, what they pointed out was with the earlier forms of the COVID-19 virus, they actually didn't see increased within the school settings. They didn't see when they did antibody tests to see how many people were truly getting infected. They didn't see any increased risk in the schools as far as numbers of people who were positive, as opposed to the general population. So we could just say that the schools are going to reflect whatever's happening out
in the
there.
Community, yeah.
So, sending the kids back to school may not be actually increasing that risk the way we think it might. They're actually in a structured setting. They're being supervised. There are more possibilities that actually that's protective in some way, or at least not making things worse.
Several employees across Canada, many employers and governments are reporting a high degree of absenteeism due to sickness or the need to isolate. What impact do you think that might have on the teaching capacity if teachers are having to call in sick?
I mean, I would anticipate that we're going to see
Mhm.
a fairly significant absentee rate
Yep.
among teachers
Yep.
that will reflect the absentee rates that are occurring in healthcare, among nurses, among personal support workers, among factory workers,
Yeah,
right? It's
yeah.
just, it shouldn't really be any different. And I heard a report that they're going to be more, I guess, retired teachers.
They've
that
approved
will
more
be,
days per year for some of the retired teachers to come back as supply teachers. You know, they're going to try and use every available resource they have to make sure these kids can be in school. Bottom line is, I agree. I think it'll be just kind of like what the rest of society is dealing with. It's not going to be easy. There's no question.
No.
But I think anybody who works with children or with families or is a family or is a child has had a very challenging time with this pandemic. And from our point of view, school needs to happen. In-person learning needs to happen.
So as parents, it's a calculated risk, or what do you think your advice is for getting the kids back?
Someone said to me today, well, it's always a risk. Being a parent is, and that was a little bit, you know, what's the word? Yeah, over the top.
Yeah.
But I think that it's a calculated risk in the sense that we have information that shows us that perhaps the infection rate is not any higher than the general population. We know that Omicron is so contagious that you're just as likely to get it as the grocery store, as you are in school or at walking by someone. I think that parents just have to measure the risks for their own children, and circumstances differ for so many families, right? Some families might be in a perfect position to do learning at home with their children, and it's not going to harm the children, and they're going to give them social opportunities. And I guess that would be their choice, but the potential harms are so much greater. And we see so many families that are disadvantaged in such a big way by the online process.
I know several people who have tested positive for COVID, but of course they don't know if they have the Omicron variant. But I do know that the individuals in question have been sick for about a week. It doesn't require hospitalization, but I'm just wondering if what you have seen from your own practice and evidence of people with COVID, what are the symptoms and how serious can it get? And especially, Kirsten, with you, children, you know, are you seeing any serious infections in children?
I think that, thank goodness, the serious infections are very, very rare. They do happen, but they're very rare. Immunization decreases the risks across the board for all age groups. Omicron itself, there's maybe some early evidence that maybe it's affecting upper airways a little bit more than it was actually affecting the lung tissues the way it was in adults. So yeah, children with their tiny airways would be at more risk for that. On the other hand, children with their tiny airways are at risk for every virus that's out there. And in the last month or so, I've been seeing all the other viruses and not really COVID in the children. I think the actual numbers are still going to be very, very low.
And I would say from adults, I mean, if you have COVID, you have Omicron basically
right
now,
for
right?
sure,
And
for sure.
Generally speaking, it's a milder disease, but by virtue of the fact of how transmissible it is, just the sheer numbers of people, even that small percentage who will get very ill, that's what we're experiencing now with the hospital situation, is that there's a small percentage of people who will get very short of breath, have chest pain, have a whole variety of bad complications. And those are primarily among people who are not protected or people who are vaccinated but have a lot like other underlying health conditions that render them susceptible.
That's right.
And speaking of vaccinations, you probably saw today that Quebec announced they're going to be introducing the most stringent vaccination mandates in the country. What are your thoughts now about the age group 5 to 11 and what we must do now to ramp up that? Children have to have measles and rubella and those kind of vaccinations. What are we going to see for children 5 to 11? Are we going to say the same kind of requirements in the schools here in Ontario?
I think our biggest concern when we talk about mandating vaccinations for children with regard to school is that some children could be disadvantaged by a decision that their parents have made. And I don't think that's fair to the child. As far as vaccinating the 5 to 11-year-olds, yes, we need to ramp up with that, and we need to talk it up, and we need to talk to people. We need to remind people that there are now millions and millions of children who have received this vaccine safely. And just please urge families to get out and protect their children, because it may not be that child, it may be their grandparent, as we've said so many times, or it may be the parent, or it may be a relative, or it may be someone that child just encounters in passing that might be more harmed by COVID.
Yeah, it's probably the safest vaccine that we have around. I mean, there's been what, 68 million doses given in this country. I mean, if I were to give out 68 million courses of an anti-inflammatory that you can buy at the drugstore without a prescription, do you know what kind of side effects we'd be dealing with?
Or antibiotics.
In terms of GI bleeds and heart attacks and strokes, it would be astronomical. So you talk, people just don't understand, you know, that what the risks are. That it's a very, very safe. So,
and parents are always hesitant to give something that they perceive as being new to their children. They're very sensitive to the sense that maybe their children are being guinea pigs. And I think we need to keep reminding them this is not a new technology. And now we have more and more and more evidence that it's so safe.
You probably saw also today the World Health Organization predicted that at least 50% of all Europeans will get this at some time. That it's spreading from west to east, that it's a wave. And obviously that has also been echoed in North America as well. Do you think once this wave passes through, then we can get back to some sense of normalcy?
Hopefully.
Here's hoping. Here's hoping. I mean, that is when you look at the pandemic, like the Spanish flu pandemic, and you look at others in the past, it almost looks as if that one big wave of whatever variant it was, we don't know the information from that, might be what it finally takes to get our populations to the point where they're immune enough.
Well, I think a lot of parents will be looking forward to getting their kids out of the house and back to school next week. And let's all keep our fingers crossed that it's a safe experience and that we can get through this safely in the next few weeks. But we should keep in touch and check in again with you in a few weeks once we see how this is all played out.
You bet.
Great.
Thanks very much to both of you, Dr. Kirsten Blaine, a pediatrician, and Dr. Sean Blaine, a family physician here in Stratford, Ontario. Thanks very much for watching.